Well, even before the pandemic, EMS workers were on the healthcare front lines every day as part of their jobs. And this week, they're being recognized. Joining us to talk more about it is Kevin Ferrarotti, System Director of Emergency Management Services, EMS Network Development of Hartford HealthCare. Kevin, welcome.
Thanks for having me.
So tell us about how Hartford HealthCare has partnered with the EMS community throughout this pandemic.
Even before this pandemic started, our EMS coordinators and EMS medical directors throughout our system have truly been just an integral piece of our relationship management with each of our sponsored services. This pandemic has increased that. Our coordinators and medical directors throughout our system have done just an absolutely unbelievable job of communicating with them, providing live updates on all of our protocols, all of our exposure risk control plans, and then even more so, we're taking a look at the wellness and the safety and well-being of our providers. So we have started a peer-to-peer hotline for our EMS providers to connect one-on-one to talk about their mental wellness and safety. We have streamlined the ability for them to be tested at any one of our drive-through testing sites, and then we're also partnering with them right now to make sure that they are not only prepared for what they're seeing today, but what they'll see over the next month, 2, 3, and months beyond that.
Yeah, they are truly the front lines. All right, talk about safety measures that are in place for the EMS community.
Yeah, our safety of our clinicians, our providers, whether they're pre-hospital or within our hospital, is paramount. Without their safety in mind, we are no value to our patients. So our safety of our providers, whether it's to make sure that they are providing or being protected from isolation precautions, making sure they have the right PPE, personal protective equipment, making sure that the protocols for how they treat patients, and we're doing so very well and coordinated through our Department of Public Health and our Office of EMS, where we're making sure that they're staying educated. And then also, you take an example such as our Wyndham Hospital paramedic team, and they're actually bringing in different types of innovative equipment so they can still provide the same quality of care that they would have gotten 10 to 12 weeks prior to, but doing so at a less of an exposure risk than they would have previously.
Okay, this is EMS Week. It has extra special meaning this year because normally you have a lot of events to recognize the EMS community, but COVID has changed. What are you doing to celebrate in these times?
Yeah, this is such a special week for us because, we are just like we did a few weeks ago with our nurses and our clinicians prior to that. We need to recognize the work that our first responders are doing every day, and EMS Week allows us to do so more formally, and albeit that we can't do so in large gatherings, we're making sure that our EMS coordinators and medical directors are out there meeting individually with safety precautions in mind, bringing prepackaged meals out to our providers. But it's really that special thanks. And then we combine that with a great marketing team that has really created a public-facing campaign all week, so using all of our digital formats. And then we're starting it off this week with tonight with a statewide EMS Chiefs call. So our system leadership will be on to say thank you and wish them well. Our infectious disease folks will be able to give pertinent updates. And then we end it with some education with our behavioral health senior vice president to bring in the EMS personnel safety and wellness aspect to it.
All right, and Kevin, let me ask you real quick as we wrap things up. Are the EMS community members feeling the community love? We're seeing hearts everywhere. Tell us about that, because we certainly hope they are.
Yeah, we definitely are. We cannot thank folks enough of the well wishes, the support, the donations, and that is something that we're seeing in our hospitals and throughout our healthcare system. But it's really that mutual respect of each other, and then having the community back what we do means so much every day. But obviously, in light of the current pandemic, it means so much more.
Oh, well, we thank you all for what you're doing. And Kevin Ferrarotti, we appreciate your time today. Thank you for being with us.
Thank you. Have a great day.
Thank you.